Good morning, ladies and gentlemen, and thank you so much for giving up your Saturday mornings for this very, very important topic of healthy aging. So these are my objectives for today. I'm going to talk about what geriatrics is, why it's important, talk a little bit about aging statistics in the United States and also in Hawaii, because we want to make it relevant to our own state. Talk a little bit about what's unusual and different about the care of the older patient, and then talk about some changes with normal aging that we see. So I'll start with what is geriatrics. And this slide, other than being really beautiful and being symbolic of Hawaii, is also a little bit symbolic of what they call the silver tsunami coming upon us, right? The baby boomers have already started to hit the age of 65, and that the next 20 years, we're going to see a great growth in this population. So when I ask that question, what is geriatrics, the answer really depends on who I'm asking. I remember when my daughter was in kindergarten, she came home from summer school, and she was talking about her teacher. And I asked, oh, how old is your teacher? And she said, oh, Mom, she's really, really old. And then when I met the teacher, she was a high school kid. Okay. But to my daughter in kindergarten, that was really old. Okay. When you're in your 20s, 40 seems really old. Once you hit 40, you realize, I'm not old, right? So the bottom line is, I think aging is 10 years older than you are at the current time, which is illustrated here by this cartoon. So this guy is sitting at the counter and saying, do you see that elderly couple down at the other end of the counter? She says, yeah, what about them? He said, I was just thinking, that's what you and I will look like in about 10 years. And she says, you do realize that's a mirror there, don't you? So what we see in geriatrics is we see the extremes. I've been fortunate enough for the last 25 years to be part of the Honolulu Heart Program, probably the most famous research study here in Hawaii. And this gentleman here is Mr. Chuck Yogi. And at that time, he was 89 years old. This was in 2008. And at that time, he was 89 years old. He was still running marathons. He was running every single day. He had a really, really strong family history of longevity. His mother lived to be over 100. His father lived to be almost 100. And he looked like he was going to be getting there, right? And then on the other extreme, we have somebody who just has trouble even crossing the street. And I think that's one of the hallmarks of aging, is we see a lot of differences. We see the extremely healthy, and then we can see people who are extremely frail as well. All of us want to end up more like this, right? Now, he's in better shape than I've ever been in my entire life. So I don't think I have any hope of becoming like that. But still, you want to remain as healthy and vital as possible for as long as possible. So what is geriatrics? It's care of the older patient. And again, people ask me, so what is the definition of old? And well, traditionally, the definition that's been used is the age of 65 and over. Now, this is really an artificial definition. I can tell you very honestly, almost none of the patients taken care of by faculty in my department are even close to 65. Most of our patients are in the 80s, 90s, and above, okay? But this age of 65 was chosen because of Social Security. Now, this was in the 1930s. And at that time, people just didn't live very long. So they came up with this age of 65 as their definition of extreme old age. And if you lived to this extreme old age of 65 in the 1930s, you got the reward of getting Social Security, and later Medicare came in. And that was kind of your reward for surviving to so-called extreme old age. Now, of course, most people live to be 65 and a lot more than that. So I think that definition is changing a little bit. Currently, geriatrics is a critical shortage specialty in the United States. The estimate is that they need 36,000 geriatricians. There are actually less than 7,000, and every year the number is going down. The reason for this is many of the geriatricians are old themselves and are close to retirement age, and we are not putting out enough graduates from our geriatric fellowship programs to fill this need. So it's actually considered a federal critical shortage specialty. And because of this, so some people ask me, shouldn't everyone over the age of 65 have a geriatrician? Definitely, in an ideal world, that would be the case. Just like most children go to a pediatrician. Some still go to family medicine, but most kids go to a pediatrician. There just aren't enough geriatricians to go around. And so for that reason, currently geriatrics has become more care of the very frail elderly. Those are the ones who need our services the most. So our own faculty practice actually is mostly based in nursing homes and in retirement communities where people are extremely frail. So you might then go on to, well, why is geriatrics important? And I'm going to give you some numbers that hopefully will convince you, just like I'm convinced, that aging is really a very important field. And I'll start out with life expectancy in the United States. So if you look at this graph here, it starts out in the year 1900, and at that time, I think the majority of the room wouldn't be alive, right? I wouldn't. So at that time in 1900, average life expectancy for men was 47, and for women was a little over 50. And you can see that as the years went on, as the century went on, by the time we reached 2000, just in this 100 years, that had gone up dramatically. It was up to 74 in men and almost 79 in women. And by the latest numbers we have are from the 2010 census, where in men, the average life expectancy was over 75, and in women was over 80. And you can see that this is projected to go up over the next few decades as well. So not only are people living longer, but you can see that and you can see this difference between men and women, okay? Now, if you look at it by age group, again, this number reflects the 2010 numbers that I gave you before. Here, in this graph, red is women and blue is men. And you can see life expectancy at birth is about 80 in women and a little over 75 in men. But what about if you're 65? Is it a simple subtraction? So if you're a 65-year-old woman, do you just say, okay, the average for the whole population is 80, so 80 minus 65, I have another 15 years to go. It's not quite that simple, actually. If you have survived to the age of 65, you're already a survivor. So you've already outlived certain things that take people away early. So you've outlived death during childbirth, or infant mortality during the first year of life. You've outlived those things that take people off at a younger age or at middle age, things like heart attacks and strokes, maybe some of the cancers. So by the time you reach 65, you're already a survivor, and you have possibly another 20 years to go. Again, this is average, so we see some who do way more than that, and of course some who do less. And even after the age of 85, you see that there's a 5 to 6 year survival after that as well. So this graph kind of plots out what the US population looks like. Again, starting out with 1900 right here, I think right here is 2000, and this is about 2010, and this is projecting all the way out to 2050. Now you see this blue line here is those over the age of 65, and you see this very steep curve. This is the baby boomers. So this is when large numbers of baby boomers will be reaching that age of 65 and over. So by the time we reach 2050, it's estimated that there'll be over 90 million Americans over the age of 65. This lower line is this green one here. This is actually people over the age of 85. And although, of course, it's much less than the 65, you can see it's still steadily growing, and again is kind of steep up here. So again, not only are people living longer, but they're really more and more are living to extreme old age as well. Now you might say, okay, this is the US and this is industrialized countries. What about third world countries? Actually, aging is happening all over the world. I'm originally from India. And of course, our percentage of older people is much lower than the US. Currently, the US is over 13% of the population is over 65. I think in India, it's closer to 8%. Still, given the population, that's over 80 million people. Japan has already hit the number of 20% of their population is over the age of 65 right now. The number that we are not expected to hit for another, or maybe 6-7 years or so. So all over the world, aging is happening. And I can tell you, all over the world, people are not really prepared for the care that's going to be needed for this older population. Now, what about Hawaii? We actually have one of the longest life expectancies in the world. Among the US, we are definitely the highest life expectancy. It wasn't always the case, though. I was surprised. I thought it was always the case. But somewhere between 1990 and 2000, we overtook the national average of growth. So if you look at the percentage of the population over the age of 65, the state of Hawaii is in orange in this graph, and the national average is in purple in this graph. And you can see, until the mid-1990s, actually, we were lower than the national average. We overtook them, and now our rate of growth is much greater than the national average. So Hawaii in particular is a very, very long-lived state. And I'll give you some of the reasons why this is. I think it's definitely our ethnic mix here. So in most places, Caucasian populations tend to have the longest life expectancy. And the minority groups tend to have lower life expectancy. There's some health disparities seen all over the country. Hawaii is one of the exceptions, actually. So here in Hawaii, the longest by far is Chinese, with Japanese being very close behind. Then comes other, then Filipino, then Caucasian. And actually, the lowest life expectancy is seen in our native Hawaiian population. So we still have a lot of health disparities and a lot of work to do here in Hawaii. And Dr. Brady, who started us off with the OLI this morning, he's actually part of the Department of Native Hawaiian Health. Again, we are the only school in the country that has that. And a lot of their efforts are not only in taking care of the Native Hawaiian population, but in doing research to try and make these health disparities less so. Again, you notice women are in red and men are in blue. And you'll notice that at every gender, at every age, women outlive men. So ladies, we are starting to feel really superior now, right? Well, don't worry, gentlemen, there's good news coming for you. And ladies, it's not going to go all our way, all right? So I'm going to go on to the next slide. This is physical disability over the age of 70. So high is actually bad here, right? This means we have more physical disability. Again, women in red and men in blue. This talks about, is there any limitation in physical activity? Not do you do it, but is there any limitation in doing physical activity? And you can see that almost 30% of women after the age of 70 have some limits in what they can do as far as their physical activity. Whereas in men, it's a little less than 20%. So definitely, the women, although we are living longer, we're also living frailer. And we definitely see that with our patient population. Women are living longer, but they're much more frail as well, and much more likely, for example, to be put into a nursing home. And a lot of that is related to the frailty. ADL stands for Activities of Daily Living. These are the basic things that you did this morning before you came in. Grooming, dressing, going to the bathroom, feeding yourself, taking a bath. Just very basic things, right, that we need to be able to do to be able to live alone and to be able to just kind of take care of ourselves. Again, you see, over the age of 70, almost 10% of women have some problems with this, and a little bit less so in the men. A little over 7% have problems with taking care of themselves. Now, IADLs stands for Instrumental Activities of Daily Living. And this is the more complex tasks. Things like, can you drive? Or if you never drove, can you take the bus? Can you take your own medication? Sometimes that can be very complicated, right? I know we have a session coming about medication use in the elderly in a couple of weeks. And you'll hear more about that. But a lot of older people are taking a lot of different medications. And are they able to keep track of it and figure out what you take and when you take it and take it properly? Are you able to do your finances? Are you able to write checks and balance your checkbook? Are you able to cook and clean the house, and do things like that. Now, whenever we look at disability, we always look at change. So, for example, if you have somebody who never cooked their whole life because their spouse or their kids cooked for them or whatever, and now they can't cook, you can't really call it a disability, right? They never cooked. On the other hand, somebody who was a gourmet chef and now has trouble making instant ramen, well, now they're having a problem. In the same way, somebody who never went to school and was always kind of bad at math, couldn't really balance their checkbook, even at baseline. If they can't do it now, again, it's not a change. But if it was somebody who was an accountant and is now having trouble just with simple balancing of the checkbook, that's a change. So that's what we look at in geriatrics. It's not what can you do, but how has it changed from what you used to do before? So this is about marital status, and this is a little bit complex, so I'm going to show you how to look at this. On this side is men, so on the left, this graph is men, and on the right, it's women. And it's broken down into 3 age groups. So the blue is 65 to 74, the youngest of the geriatric population. And the sort of brown is 75 to 84, and the green is 85 and over. And on this axis, we have never married, divorced, widowed, and married. Okay, and the same for this one. So you can see, just at a glance, most older men are married, whereas most older women are widowed. Now, 2 reasons for this. We've already seen that women in general outlive men, right? We have higher life expectancy, so we live more number of years. In this generation of older people, women also tended to marry men older than themselves. And so again, that kind of leads to more women being widowed, whereas most men still have their wives with them. Okay? And I think this is part of the reason why we see more women in nursing homes, because they tend to be left without their spouse, because the spouse usually passes away before the wife does. Whereas most men, their spouse survives to at least as long as they do. So this is a phenomenon we see pretty much all over the country and even all over the world. Now, what about people who live to 65 and above? Well, one of the things is that most people over the age of 65 have at least some chronic diseases. In this day and age, it's very rare to find somebody over 65 with absolutely nothing. And no matter which way you look at it, the 2 most common are high blood pressure. It's called hypertension here, and that gets people a little confused, but that's what hypertension means. It's high blood pressure. Or arthritis. And those always, no matter which survey you look at, they're always number 1 and 2. They flip around sometimes. Sometimes hypertension is 1 and arthritis is 2, and sometimes it's the other way around. But those are clearly the most common chronic diseases of older people. Hypertension is one of those diseases, high blood pressure, that most people who have it, they have no idea that they even have it. They have no symptoms at all. The danger of high blood pressure is what damage it does to us over many, many years. So you may have high blood pressure in middle age and have no symptoms and figure, why should I bother to get this treated? Because I'm not feeling anything. The problem is it's doing damage to your organs down the road. And so 10, 20, 30 years from now, you'll have the bad effects of high blood pressure on your heart, on your kidneys, pretty much on every organ in your body. But at the time, you don't have any symptoms. I think that's why I find it so dangerous. And when I see patients with it, I try and do a lot of education to say, right now you're not having symptoms, but the medication or the exercise or whatever you're doing to control your blood pressure is an investment for your old age. So what are some of the other chronic problems? Well, heart disease is definitely one of the most common. This is stroke, asthma. This is lung disease, bronchitis or emphysema, cancer, and diabetes. Now, there's one disease that's lacking from this. That's a common disease in older people. Anybody want to throw out a guess? Dementia. And I think the next talk is going to talk about dementia. So I'm not going to talk too much about dementia, but you're right, it is. That's the one that's lacking here. Is it because it's an uncommon disease? Unfortunately, it's a very common disease. The reason it's not here is because much of dementia is missed. And a lot of people who have dementia, they look completely normal, and even their doctors get fooled because they can be quite socially appropriate in the early stages of dementia. And even family can be fooled because their long-term memory is still good, and yet they may have the early stages of Alzheimer's disease or other dementias. And so I feel like this is glaringly lacking from this graph, and it really should be there. And I think if we use better methods of detecting the disease, hopefully it will eventually end up here. So I think I'll leave it to Dr. Blanchette to talk more about that. So what are the principles of geriatric assessment? Well, our goal is really to promote wellness and independence. It's not to keep people alive forever. I have people tell me that. It's like, how long do you want people to live? And that's not really our goal, is to keep people alive forever but have poor quality of life. What we really want is to keep people as vital, as independent, as functional as possible while they're here with us. So our focus is very much on functional status. And this is something that actually is different from the rest of medicine. We do a lot of teaching in my department. We train internal medicine and family medicine residents. We train medical students. And they're really well taught about diseases. So they're really good at figuring out what's going on with the heart and the lungs and the kidneys. But when they're presenting a case to me and I'm asking them things like, well, where's this patient living? Who are they living with? And what can they do for themselves? Or what do they have trouble doing for themselves? They kind of look at me because they've never even thought of that. Well, that is the essence of who that person is. They're not just an addition of heart, lungs, kidneys, all of those things, right? We want to get at the core of who that person really is, what's important to them. So we talk a lot to our patients to ask them, what's important to you? Is it living longer or is it having better quality of life? That's the kind of thing, we try and have that conversation very early so we can figure out who is this person, what's important to them, and how can we help them achieve their life goals. So our scope is not just physical. We don't just look at the organ systems. Of course we look at that, but we also look at the cognitive. How well is the person thinking? How good is their memory? We look at the psychological effects. A lot of older people can be depressed. I remember my mother-in-law one time, there was 1 week when she had 3 funerals to go to. And I remember telling her, wow. And she said, I'm getting old. And many people who are my friends are dying at this age. She was one of those people who remained cheerful no matter what. But a lot of people with older people do get depressed. They get lonely. So we look at those aspects as well, too. I think you talked about the social domains. Remaining socially active is so important. Many older people, they're very socially active, but after the death of a spouse, they might tend to withdraw. And it's up to us to try and find ways that they may want to socialize. Again, depending on the person's preference, right? If they are into sports, maybe they can do something with other people who like sports. If they're not, maybe other arts and crafts, things like that. So our approach is very interdisciplinary. It's really impossible for one person or one type of health professional to take good care of an older person. We really need to work together. And our success is, again, not the length of life, but maintaining quality of life. That is really our main goal in geriatrics. So what are some of the things that happen with aging? Well, one of the things we notice for sure is that susceptibility to disease definitely increases. Our immune systems, for example, are not as strong in old age as they were in young age. So I think, Virginia, you're going to be talking about vaccines. But when there's a flu outbreak, who are the people who are affected the most? It's actually the two extremes of life, right? The newborn babies and the very old. And they're the ones who are affected the most. So in nursing homes, for example, we are so careful about trying to immunize not only the patients, but the staff, trying to limit contact with people who are sick, because even if they've been immunized, maybe they won't be able to mount a good immune response. So they're very susceptible to getting sick. And when they get sick, it's not just a nuisance, it can be really dangerous. So if I get the flu, I'll be laid up a little bit and I won't feel very good. Maybe I'll be staying home from work for a few days. But an older person, that might be what finally kills them. So we're very careful about that. Now, both genetic and environmental factors can influence the rate of aging. So we talked about that man, Mr. Yogi, remember the marathon runner? He actually happened to have the longevity gene. Again, that was one that was found in our Honolulu Heart Program. It's called the FOXO3 gene, and he actually had the so-called good gene in his family. And that's why he had this really strong family history of living to extreme old age. But what we've found is it's not just your genetics, because unfortunately we cannot choose our parents, right? So our genetics are fixed, we cannot modify that. But what we have found is, even with good genetics, if you do things like smoke or drink too much or not exercise or eat badly, you will still have the bad effects of those things. And again, just because you don't have the gene, you can't just throw up your hands and say, oh, too bad, I'm unlucky, I'm not going to do anything. Because we found even people without the gene who follow the healthy lifestyle can do very well and live what we call successfully age and be very functional as they age. One other thing is great variability among the elderly. So by this I mean, let's say I take a group of 20-year-olds, 100 people who are 20 years old. And on this side, I have 100 people who are 80 years old. And I measure anything. It could be bone mass. It could be heart muscle, how well the heart is pumping. It could be kidney function. The 20-year-olds will all be very similar to each other. Most of them will be in sort of the small range. You look at the 80-year-olds, you'll have a huge spread. You'll have some who are completely normal, but then you'll have more and more who have problems, and you'll have some who have extreme problems. So what we see is one old person is one old person. It doesn't mean that you should generalize and assume, of course, their heart won't be beating as well. Of course, their blood pressure won't be as good as a young. Their kidney function won't be. Okay? They have a greater likelihood of having problems, but again, we have to really individualize. And the ability to maintain what we call homeostasis. This is sort of keeping a balance. This decreases with old age. So again, when you hear, we read in the newspaper that there was a heat wave in Chicago and 100 people died. Usually, again, most of those will be the very old. Why? Because their ability to maintain the balance of fluids and electrolytes is not as good as younger people. So if a younger person gets dehydrated, which is what happens to these patients, if a younger person gets dehydrated, you get thirsty. So that your body is kind of telling you, right, drink more water, I need it. An older person, the thirst drive is decreased. So they may not be able to realize even that they're getting dehydrated to drink more. A younger person will sweat. An older person doesn't have enough muscle mass to even sweat and to get rid of some of the heat from the body. So again, your ability to kind of keep the balance in your body is decreased. So I have a lot of people who, they have older parents maybe, who were doing quite well. But then something happened, some small thing, it didn't even seem like a big thing, and then they just had a really hard time recovering. That's because older people just don't have as much reserve. So the slightest little insult can really drop the older person, and they'll have a hard time coming back to what they were before. So taking care of older people, you have to be a little bit of a detective, because the presentation of illness is not the same in older people as young. So sometimes the complaint that'll come to me is, oh, Mom is really confused right now. And so you might think, okay, confusion, brain, something's happening in the brain, right? It may turn out that mom just has a bladder infection. It's not in the bloodstream. Why is the bladder infection on the other side of the body affecting the brain? Well, it just does. And so when we take care of older people, particularly people with dementia or Alzheimer's disease, we have to be real detectives to figure out what could be causing the symptom. So atypical presentations can be things like falls. So somebody who's, of course, falls are a chronic problem in some older people, but if somebody suddenly starts falling a lot, I have to really look and see why. Why are they suddenly falling? Did they have a stroke? Are they having some infection? Something is happening, and we have to really look for it. Confusion, weight loss. Now, this is the one time when my older patients, in fact, weight loss to me is very dangerous in an older person. And I really, really liberalize people's diets when they get to the point where they start losing weight. Because, and you know, we have this lifelong habit, right? I want to eat right. So I want to eat low cholesterol. I don't want to eat too much sugar. At some point, I tell patients, eat anything you want. Because really, getting into that weight loss spiral is really dangerous. And I don't want that to happen. So at that point, I give full permission to eat dessert every day if you want, whatever you want, okay? I'm waiting to get into that age where I'm being told that. Hasn't happened yet. Urinary incontinence, same way. It could be the sign of a heart attack. Again, why? Because again, older people have lower reserve in every organ system, and the slightest change might change the whole balance of their body. You can have misleading symptoms. So for example, I've had patients who have pneumonia. I mean, it's a full-blown pneumonia, and yet they have no fever. In fact, their temperature might even drop a little bit. Remember, fever is our body's mechanism of taking care of infectious diseases, right? It's actually a protective mechanism. That's what your body is doing. It's the fever is the body fighting the infection. If the person's immune system is really bad, they can't fight that infection. They won't have the fever. So again, you have to be a real detective to try and figure those things out. Signs of one disease can be obscured by another. The heart and the lungs are so delicately balanced with each other, sometimes it's very hard to know. Is this the emphysema getting worse or the heart failure getting worse? Yes, the lungs are filling with fluid, but which one is it? It's very hard to tell sometimes. And sometimes you can have no symptoms at all. You can have a silent heart attack, a silent stroke. We see that so often. So let's say that I have a patient who's coming to me and the daughter brings the father and says, Dad is starting to have some forgetfulness and memory problems. So I do my full workup, and as part of that, I do a scan of the brain. And I find little strokes in there. And I go, I've done a full history. I didn't get a history of stroke. I go back and I ask them, did Dad have a stroke ever? No, he's never had a stroke. Well, it was silent. He had it. It shows up on the brain scan, but he didn't know he had it. Same way with the heart. People can have silent heart attacks, and it'll show up on the EKG, but they didn't even know that they ever had one. Okay, so we have to be very, very careful about looking for things. So our approach, again, we focus on the whole person, not just heart, lungs, kidneys. We really want to know more about the person. We want to enhance independence and quality of life because that's what most older people will tell me, that's most important to them. Not living to the age of 100, but having good quality of life while they're here. Preventive care is really, really important. So some of the things that Virginia was talking about, eating right, exercising, taking your shots. Again, listen very carefully when it comes to the immunization stock because that makes such a huge difference. In fact, I just want to, that big increase in life expectancy that we saw. Remember 1900 was below 50? And by the time we reached 2000, we were up to the 75, 80 range. Well, people wonder about why that happened. Part of it is definitely our medical care has improved, right? Now we have antibiotics. They didn't have antibiotics in 1900. So now we can actually cure certain things that people died of before. But definitely a huge part of it is immunizations, public health, having people have clean water, have sanitary living conditions. Those things made a huge difference in life expectancy jumps. So preventive care is really, really important. Rehabilitation, I cannot tell you how much I love my rehab partners. Physical therapists, occupational therapists, speech. They can work miracles for older people to get them back. Again, our goal is to get them back to their baseline, right? A few days in the hospital can make an older person so deconditioned that somebody who was previously quite independent now has trouble just walking across the house. A little bit of physical therapy goes a very, very long way to get those people back in shape. And then at the end of life, palliative care. We want to make sure that as our older people pass away, we give them a dignified, pain-free death and follow their wishes as much as we can. So again, the approach is interdisciplinary. We have lots of different physicians we work with. The geriatricians work with neurologists, urologists, basically all the ologists. Nursing and social work are our big friends. In fact, there are times when the social worker is more important for that older person's care than the physician, because the medical problems are minimal at that point, but maybe there are a lot of social issues going on. So we try and work in partnership. The rehab people I've already talked about. Nutrition is important. Many, many others that I can't name. So you remember Hillary Clinton saying it takes a village to raise a child. I always say it takes a team to take good care of an older, frail person. So let's go on to some of the changes of normal aging. Well, what we see is 19% of people over the age of 70 have serious visual impairment, and this can really impact quality of life. I've had bad vision, unfortunately, my entire life, starting from childhood. I remember when I was in elementary school, in my school, they used to do an eye test every year. And I actually went and memorized the eye chart because I didn't want to wear glasses. One of my more stupid decisions in my life. But I remember I really, really didn't want to wear glasses. And so I went and memorized the eye chart. And so I'm particularly careful about my eyes because I don't have good vision. Over the age of 70, many people have serious visual impairment. This is not what, I don't mean just wearing glasses. This is uncorrectable visual impairment. In Hawaii here, we have a lot of vision problems from cataracts. Fortunately, very, very correctable. We have high cataracts rates partly because of our lovely weather, because sun exposure is the biggest risk factor for cataracts. So again, that's one of the few that can be well treated. There are others that can be treated, others less so. So vision is something we really try and preserve as much as possible in our older people. 1/3 of people over the age of 70 have serious hearing impairment. And by far, the biggest risk factor is loud noise. And so every time my husband is walking around with his little iPod on, and I can hear the music, I can hear it from far away. And I'm always telling him, when we're old, you're going to be deaf. And then I'm not going to be taking care of you. So I'm trying him to kind of tone down that music. But a lot of kids do that, right? They wear earphones and turn on music very loud. And that can definitely cause a lot of hearing damage. So fortunately, we do have a lot of different hearing aids. This one is the behind the ear one. I think this one is in the ear, and then these are the smaller. They're getting smaller and smaller. The smaller they get, also the harder they are to use. And so a lot of people's hearing aids, unfortunately, end up in the drawer and not in the ear where it belongs. So that's something, again, we're working with. We have a wonderful communications and speech disorders department here at JABSOM. And so we work with them to try and optimize hearing in our seniors. Skin. Again, one of the wonderful things I love so much about Hawaii is our lovely weather. It's also very bad for the skin. Sun is very bad for the skin and cause all kinds of aging changes. We do notice that as people get older, the skin gets drier and it gets thinner. And actually, there's a picture right here. So on the left here, I have young skin, and on the right, I have older skin. And you can see the older skin is definitely more wrinkled. there's less fat. You see here, there's a lot of fat padding the skin and sort of protecting it. And here, this fat is kind of shrunken. Now you're saying, wait a minute, you said you're going to get more fat accumulation as you age, right? It's true, but it's not under the skin. So the fat under the skin actually gets less. The fat migrates to other parts that I'm hiding behind this podium, okay? So the skin, unfortunately, doesn't have that layer of fat to kind of buffer it from injury. So actually people who are older, their skin can tear very easily and they can bruise very easily. So I often see people with bruises all over their arms. And I ask, what happened? And they say, I don't even remember. I must have bumped into something, but it was so minor that I didn't think about it. And yet you see the arm is completely covered in bruises. Now, what about balance? Well, falls definitely get more common with aging, and I make it a point to try and do balance testing and also recommend exercises to my older patients. So, Virginia doesn't know this, but I'm going to ask, may I use you as a... Yes, may I? Come right up here. So I'm going to do a little demonstration. Virginia didn't know this, so I apologize in advance. But I'm going to do a little demonstration of some of the changes that happen with aging and why people fall more easily. Okay? So I'm going to have you come right up here. So one of the things that happens with aging is the posture changes, and people are bent over a little more. So I'm going to have Virginia bend over a little bit. Okay? The other thing that happens is people's gait gets a little wider. Your center of gravity is more forward. Bend a little bit at the knees, just a little bit. That's a little bit more than, but that's okay. And now you're walking with shorter, kind of shuffling steps. So if you could walk a little bit, okay. Okay. Thank you, Virginia. Thank you for being such a good sport. But you can see it wouldn't take a lot for her to tip over, right? So you see these kind of normal changes with aging, which were a little exaggerated when Virginia did it, but it kind of illustrates the point, where the slightest tip I would have given her would have plunged her right over. And so definitely we see increase in falls in older people, and that's something we work really hard against. What happens a lot is this sort of cycle. So an older person falls, and they get this fear of falling, right? I can understand that. I would be scared too. So what do? They exercise less. They actually limit their activities because they're scared of falling. What does that do? That deconditions you even more. You get into the cycle of another fall, more deconditioning, another fall. What we really want to do is physical therapy to build up your muscles, to teach you how to walk, how to fall, what things not to do, what things to do, and then to do certain balance exercises like Tai Chi. Tai Chi has been shown in many studies to be extremely effective in preventing falls. So that's what we want to do, not have the person do less and less and less, which is unfortunately what ends up happening. Now, what about body composition? Okay, bad news, folks. Bones. I want you to take a guess. When do we start losing bone mass? We all know, right? As we get older, we lose bone mass. That's why we're more likely to have fractures. Any idea about when does this start? Anybody want to throw out a number? Yeah, in the 30s. So if we say, okay, now I'm 50 or now I'm 60 and I want to protect my bone, you've already had decades of losing bone. So what we really need to do is we need to work in childhood and young adulthood, first of all, to build as strong bone as possible. And then we know it'll be lost. No matter what you do, you will be losing bone, but hopefully it'll be so high to start with that it won't fall into the fracture threshold for a very long time. And we know that exercise can preserve bone mass. So this is something we try and tell people, do early. Start exercising, do it all your life, so that you have that healthy bone. This this diagram here shows you, this is healthy bone, and this is osteoporosis bone. And you can see it looks like they both look like sponges, but this one has a lot more holes in it, right? You can see how it would be much, much easier to break that bone than it would be the other one. So exercise, again, is very, very good for us. Same with muscles. If you don't use it, you will lose it. So we want to keep people exercising and fit so that muscle loss is minimized at least. We know you will be losing muscle with aging, but you want to minimize that. And as I said, fat, unfortunately, becomes a traveler. So fat from the good places, like under your skin, gets less and less. And in all the bad places, which I'm hiding from you right now, it gets more and more. And so we get a lot more intra-abdominal fat and fat around our organs, and a lot less fat under our skin where we really need it. So in ending, I just want to say we should avoid stereotyping people. We have old people who can do amazing things that I could never have done in my life. And then again, on the other extreme, we have old people who can do very little because of whatever frailty or diseases have overtaken them. So avoid stereotyping people, and again, ask them what is most important to them. That's one of the problems, I think, that most family members don't know what mom or dad really want. And a lot of families will say that, oh, we don't want to talk about those things because it's bad luck. Well, then when mom or dad become frail and old, and we're asking, what was their priority? What would they want? Sometimes we get an answer and sometimes we don't because families don't talk about it. So I'm going to just say thank you for your attention, and these are some very useful resources. In Hawaii, this is a particularly good resource. It's called Health Trends in Hawaii. It's on the website. It is a fabulous website. Whenever I want any kind of statistics about health in Hawaii, I go to that. They update it on a regular basis. You can download graphs. In fact, some of my graphs were from there. So I really recommend that website highly. Okay, I'll stop here and see if you have any questions. Okay.